that joy and saying I can make a difference for someone else is exactly why I decided education was going to be such a core part of how I show up in this profession and in this house of medicine.
Welcome to another episode of Chief Influencer. I'm your host, Anthony Shop, co-founder of Social Driver. Let's face it, Washington is the center of influence in the US and arguably in the world. Chief Influencer features leaders who have figured out how to break through in today's fragmented and fast-changing environment. Social Driver teamed up with the Communications Board and the George Washington University College of Professional Studies to recognize these incredible leaders as chief influencers and highlight how they inspire and influence others. I am thrilled to introduce today's guest, Graham McMahon, the President and CEO of the Accreditation Council for Continuing Medical Education. It's the national authority advancing innovation and quality in clinician education to improve healthcare. And Graham will tell us all about what that means soon. But before we dive in, just 3 things that I think that you should know about today's guests. Number 1, Graham is reshaping what medical education can be. From his early days as a program director at Brigham and Women's Hospital to his leadership at ACCME, Graham has consistently redefined continuing education, not as a compliance task, but as a catalyst for professional joy, curiosity, and better patient care. Number 2, he brings clinical and academic credibility to national conversations with experience spanning Harvard Medical School, editorial leadership at the New England Journal of Medicine, and research in endocrinology and diabetes. Graham is widely respected as a bridge between the front lines of medicine and the systems that support it. And lastly, Graham leads by modeling what good looks like. His approach to influence is grounded in humility, transparency, and integrity. These are not things he told me to say. I learned these from his team and from reading about him. And whether he's speaking out against misinformation or he's building frameworks for equity in education, he believes in walking the talk, encouraging clinicians to see learning as a lifelong privilege, not a checkbox. Graham, you have been called many things from physician to educator, editor, systems thinker, and even honorary fellow from the College of Physicians and Surgeons, Pakistan. Well, today we're thrilled to call you Chief Influencer. Welcome.
Oh my gosh. Thank you, Anthony. That's a crazy introduction, but very kind. And I very much appreciate it. I wish all those things were completely true.
I think they're very true. It's always good to do something, not just read the stock bio for someone. And it's interesting, because as we talk about your field, I mean, it's something many of us don't think about, and we kind of take it for granted, I would say, continuing medical education. But you're leading, the most influential organization that shapes how clinicians learn and grow. So to start, I thought I'd just ask, what drew you first to continuing medical education and what keeps you inspired by it today?
Well, I am inspired by it and I love this role. I feel privileged to have it. What drew me in was my joy in learning myself, but also observing learners around me when I was a medical student teaching my classmates, when I was a junior resident teaching the medical students and the residents around me, as a endocrinologist teaching my peers, just seeing what you could do by talking human to human between sophisticated professionals who spent their entire career building an intellectual acumen, giving them something extra is just a joy, and making that a fun, interesting, fulfilling experience brings a requirement that you bring expertise in the approach that you have to education, to learning. You can't just tell somebody something and expect them to retain it. You have to motivate them, help them understand the context of why it's important to grab this piece of information at the risk of displacing something else. And then you have to use systems like reminders and repetition to really bridge that, and then practice so that they have an opportunity to actually implement what they've learned. Sophisticated healthcare professionals are sometimes hard to reach. They're extremely busy. So I really enjoy the challenge of trying to think about ways to engage, to activate, to motivate, to incentivize, and to reward the types of learning and performance that really makes a difference to patient care.
And I would say the work that you do is probably more important now than ever. I mean, just thinking personally, when I went to the doctor a couple decades ago. I didn't really have the ability to do much research or fact check or come in with information on my own. I'd have to maybe go to a library and get a book that'd be hard to understand. But now patients are pulling out their phone and they could go to Google, they can ask ChatGPT. So they have all this information at their fingertips. So making sure that clinicians are up to date on the latest, greatest trends is probably more important than ever. And it's probably a bigger challenge than ever in terms of the trust that we have to build. So can you kind of talk about that context and the importance of the work from that standpoint?
Yeah, you're absolutely right, Anthony. It used to be that information was the currency of medical education, and now it's not. That's kind of a surprising thing to say, right? That education is not about information transfer, because information, like you just said, is all around not just us, but our patients. They can and we can access information at a click. And so as a result, medical education has turned into the application of information to complex problem solving and contextual approaches to the right care for the right patient at the right time to ensure that they get the best outcome. Because it's more common than not that what you might read as a generic response for how to treat your depression or your migraine or your gallbladder disease is right in many cases, but not right for you. And the challenge of helping sophisticated professionals is getting them the information, of course, it's all around them, but then helping them apply that information to the context of an individual patient that's sitting in front of them, lying in front of them on video, what have you, or asking them a digital question. All of those things are really important. And it's the humanity of that sophisticated thought process that can't be emulated, at least not yet, by these complex systems. And it elevates and makes even more important than ever, like you said, the role of the human clinician to engage with that patient and support them to the best decision that is right for them.
You've described your role at ACCME in the past as both a steward and a catalyst. And I wonder if you could talk about how you balance preserving trust in the system while pushing it to evolve.
Oh yeah, such a good question, Anthony, and it's a real challenge. Is that as the system of education, how we think about learning, how we think about performance management for professionals has changed dramatically since I've taken the helm at ACCME now 10 years ago. And that means that we as a regulator have to keep up with the evolving approaches to learning and change and training because they're very different, and they were disrupted very substantially, as you know, during COVID, for example, when people didn't get together and had to learn digitally, etc. And the rules for what we say counts in education, what we think is meaningful for learning, has had to evolve, and we have had to embrace not just different forms of learning, but focus instead of the mechanism for learning on the outcomes and say, let's not just say it must be form A or form B or form D, but we don't care about how you educate. We just need you to show us that the learners have learned. And if that is making people wear yellow hats and do a samba, fine. We don't really care how you get there, but show us that your learners are benefiting from what you're doing and improving their skill. And that flexibility in a regulatory approach allows evolution and innovation because you focus on what really matters, not just the structure you could regulate and you could define and you could constrain with all sorts of justifications. But if you take a permissive approach, trust your community, hold them accountable for sure, but take that approach, you can generate a lot of innovation, evolution, and improvement and flexibility that modernizes the entire approach to recognizing the changing facts of how humans and professionals learn.
Does that mean maybe you used to measure inputs like hours spent, and now you measure outputs like whether the person actually has mastered the concept?
So it's very much true that we work very collaboratively with a whole range of organizations, including, for example, the certifying boards. And the certifying boards set exams and assessment programs to determine if a dermatologist knows all what she needs to know about dermatology today, or a thoracic surgeon know what he needs to know for thoracic surgery. Regardless of that approach, we collaborate with them. They make assessments to understand a gap an individual might have, usually unknowingly to them, and then say, dermatologist, you're great at squamous cell cancers, not great at melanomas or cosmetic surgery. Here's a variety of training programs that are hosted in the national ecosystem that might help you grow in that area. And we'll check you in a couple of months' time to make sure you've recovered that skill and remediated what you need to do. That opportunity to collaborate while allowing flexible approaches to educational innovation allows that learner to identify their gaps, believe that the gap really exists because the assessments are meritorious, and then have a whole access to a range of suite of options of how he or she is going to learn the best next steps to maximize their performance.
I know one of the things you've done is pushed CME to be more than just compliance. That it's really a cultural force. And in a time when misinformation spreads so quickly, I wonder if you could talk about the role that medical education plays in building public health and health resilience.
Yeah, it's a really challenging issue because there's a lot of vested interests in promulgating, unfortunately, misinformation, often for commercial advantage. They want to prioritize or promote their corner store that might do infusions or therapies that are illegitimate but are commercially advantageous. And they take advantage in many cases of vulnerable people who are suffering and in need, and to say, here's a simple, easy, maybe even cheap solution to help you feel better. And that kind of breaks my heart, because that is just taking advantage of people when the science isn't there yet. So we do have important rules and requirements around scientific integrity. That's our public service. We have a responsibility to ensure the education that's presented to the medical community, the clinical community, is valid, is reliable, is accurate, is scientific, and is backed up by evidence. Otherwise, we would be promoting charlatanism and essentially a disruption of the scientific integrity that the House of Medicine brings to the public care. So we do have those responsibilities. We do implement them, but then we balance them with this importance of deploying best practices and being excited about what you can do with all of the new fantastic tools that are available to us, whether they are new surgical approaches, new medical approaches, a way of counseling a patient. All of those things end up being very important for how we do our work in the House of Medicine. Because like you said, it hasn't been the same way for a single day, in the last 100 years. The world of medicine is changing every single day, and doctors, nurses want to keep up. They want to do right by their patients, and we have a responsibility to create a system that they can trust and that gives them what they need so that they can provide the best possible care for patients that need them and trust them.
Yeah, absolutely. You mentioned earlier just about the importance of collaboration, with others in the field, and ACCME works with clinicians and regulators and boards and accrediting bodies, and that collaboration obviously is important for you. But as I think about some of our other audience for chief influencers, they may be in a totally different field, and they're in a world where that type of collaboration and cooperation is probably also more important to them than ever. And I wonder if you could talk about what you've learned as a leader about building bridges across silos to create system-wide change. Some lessons that might even go beyond healthcare for other folks who are listening to this and might be in a different industry, but could learn from some of the lessons that are parallel to their industry.
Yeah, I would say that a core lesson here is a balancing act between the truths you hold as clear and focused and meaningful and real for you. Those are things that you really can't compromise on. And when you have those truths or you have those key elements, you know what is the bottom line. We can't cross the line and compromise those key elements that make us what we are. But on the contrast, you have the opportunity to sacrifice some of your autonomy, some of your control for the greater good. And that requires you to spend time, spend energy to get a little more out of your system by collaborating with others. But you can't do so by expecting them to compromise and come to you.
Mhm.
Especially when you're like, we dominate the regulatory system for continuing education. If we said everyone can come to us and follow our rules and standards and maybe we'll talk to them, that would be haughty, condescending. It wouldn't be supportive and truly collaborative. For example, there are often, for example, historically at least, hierarchies in the house of medicine. Doctors were, above nurses, and nurses were above medical assistants, something like those hierarchies of yore. And we had to say, listen, those hierarchies and these siloed systems of regulatory oversight are compromising the ability for teams to work together. So let's compromise our kind of our prioritization of our own rules. Let's collaborate with our colleagues in nursing and pharmacy in particular, and now with 10 other professions to come up with a set of framework and rules that work for all of the community and help us build educational programs that meet multiple needs for individuals from different professions who are learning together. That required a lot of compromise and a willingness to sacrifice our autonomy and control for the greater good. Those things end up being very much pivotal for allowing systems to grow, harmonize, meet the real needs of clinicians rather than the needs of a regulator to own that control and navigate it with a firmness that is usually unnecessary.
Are there, I mean, you've been at this now for a decade. I wonder, are there any specific examples that you could talk about when it comes to collaboration and sort of the outcome you were able to achieve through that?
Well, other than our collaboration across the professions, another collaboration that I mentioned earlier was our collaborating with the certifying and the licensing boards, for example. So this opportunity to say, listen, you have particular requirements for what you want physicians and others to show to you. Let us navigate the data reporting system so that doesn't become the barrier between the learner and their learning, because that just generates compliance. Hey, Anthony, you got to do a course on cardiac arrhythmias and show a certificate that you've done that, and then upload that certificate to some website to complete a compliance check. You're going to do the minimal you need to do to check that box with the cheapest, easiest course, and you're going to work hard not to learn a single thing because you don't even think you should be doing it, right? If you take that whole structure away and say, listen, let's work with the certifying boards to create a seamless data infrastructure that allows Anthony to focus on his learning, not on compliance, then we take away one of the barriers to active learning and skill improvement through a collaborative data network that we now share with the entire ecosystem and our CME passport system, it's called, that's freely available. It's not a money maker. It's a service we give to the community and the profession because we are collaborating with others to make systems that elevate education and get compliance to be a lower requirement or expectation from individual learners.
Hmm. I'd love to hear more about the philosophy of that, of doing it, with, not at, is something I know you've said to me before, and the philosophy of that I think is really helpful for folks to hear. And I wanted to, with the example you just gave, maybe you can talk a little bit more about the how of, if somebody says, okay, yeah, I want it to feel more collaborative, but they may struggle to think about, how do I actually do that when there might be some resistance there. How do I go from that at relationship to that with relationship so that we can, find areas of cooperation and collaboration?
Yeah, it is. It's just like creating collaboration or positive relationships at home with our personal lives. It's about first establishing a reputation of trust where people feel like they can trust you and they can talk to you openly and honestly. If you have that as your foundation, you can actually get started with a conversation that says, let's do something a little different, maybe a little bit brave for us to create a better system. I think the third thing then is setting an objective that is shared as a goal for you both as collaborators, saying, listen, look what we could do if we did something cool, interesting, potentially risky together, and be focused on that goal, because if it's a common goal and you can both benefit from it and you can see the system would be enhanced by it, then building on that leverage of trust, setting an opportunity for growth, setting a goal, and then providing a reasonable and fair framework, infrastructure, pathway to get to that goal is very helpful. In many of my patient conversations, when I'm trying to get them to make a change, for example, I often start with things that matter for that patient. You know, they don't want to be up at night to pee. Maybe the guiding principle that gets them to good glucose control, even that's very short term. I know I can solve that problem for them. And I'll say, listen, just take this medicine for 10 days. Let's see if it helps you reduce how often you're getting up at night to pee. And as a result, now the patient trusts me, sees a positive experience in a short period of time, and now engages with me to take that medicine for an extended period of time, even though I might have presented it as a short-term experiment. So all of these things line up: building a reputation of trust, setting a goal, making it a shared objective, and then finding a plan that works for people, that sets short-term benchmarks that they feel are meaningful for them and help them not just have to not pee at night, but also generate a better, greater long-term objective and outcome that is mutually beneficial.
And that is such a great framework. I mean, because you can use it with a patient, you can use it with a doctor, you can use it with another collaborator, you can use it in your personal life, your professional life, starting by building that reputation of trust, right? How you show up um, everywhere, right? Your reputation isn't compartmentalized. It's a shared objective, and continuing on. And I think on that sort of thinking, I mean, you really, I like how you started by saying it's the same as in your personal life. One of the things that I've learned interviewing over 100 folks as part of Chief Influencer, all these amazing leaders, is that the title that people have on their business card, usually someone else has had to give them or grant them that title. They were elected or they were appointed or they were hired by a committee. But the title of chief influencer is something that only that individual can choose to embrace themselves, to say, I'm going to build the power of my influence and my personal brand to advance this mission. And I found that one of the keys to unlocking that power of a chief influencer is authenticity, showing up authentically in a human way. And I know you've shared that your personal identity helps to shape your leadership, being a gay immigrant, being part of a multiracial family, being an endurance runner. And I wondered if you could talk a little bit about why you think it's important for leaders to show up as their whole selves if they want to be effective at influencing others.
Yeah, it's such a key principle for how I've learned to live my life is that, I present as a white middle-aged kind of executive, and people thin slice me that way, but they don't realize the complexity of what makes me, just like people will thin slice any of us in terms of the constructs that make us real. I mean, I remember before I came out, and when I was like even a resident at the hospital I was training at as a graduated doctor, I still wasn't out, and finding that I felt constrained in how I could come to work, how I could do my work, how I could interact with others. For example, I was very hesitant to socialize with my peers and classmates because I worried that if I got drunk, I would expose myself in a way that my identity would be revealed and I would be ashamed. Like those kinds of constraints loom large for those that have or perceive themselves to have a secret, and that is very limiting to not just your growth as a person, but also your work as a professional. So the liberty that you get from allowing people to be authentic and to be honest uh, gives you the opportunity to sacrifice that veil of secrecy that can stand between individuals in their growth together to be authentic, build that relationship of trust that then generates all of that positivity, that feeling of connectedness, that being able to be cared for and to care for others in an environment. Those are what make us able to do our work, especially in hard times. So I think that authenticity and allowing that authenticity amongst your team, amongst the people you work with, amongst the patients you serve, without the judgment that might otherwise naturally come from that, it allows people to be their true self and bring that diversity of experience, of lived experience of life to the work that we have to do, makes them bring new ideas and interesting approaches and different ways of thinking and understanding barriers that somebody might have to be really great. So I feel like it's a key part of being human in today's ecosystem, and not making assumptions, I think, that we all often do about each other, to allow us to be authentic and then build on that to be trustworthy and generate a positive work environment.
This episode is brought to you by the George Washington University's College of Professional Studies. With in-person and online programs ranging from master's degrees in public relations strategy to certificate programs in digital communications, GW offers more than just the credentials to help working professionals get ahead. It prepares them to be leaders in their field. Check out cps.gwu.edu for more information. Thank you for sharing that. I think that's really powerful. As I think about that and how it connects back to the work you do every day, I wonder if you could talk about how you approach inclusion in continuing education, particularly in today's climate, not just who participates, but how the education is designed and delivered to meet, everyone.
Yeah, it's a really interesting, I suppose, dilemma for the system, is how we optimize its fit for the extraordinary diversity of different types of even physician or healthcare professional today. You can imagine the needs for learning of a forensic pathologist are very different from the needs for learning for, a plastic surgeon or a primary care doctor working in a rural or underserved community. Those types of information, skills that each of those professionals needs are almost completely different from each other. So in order to create a national infrastructure that supports the profession as a whole, you need to facilitate the growth and delivery of a wide variety of educational opportunities, and allow the market, so to speak, to respond to the changing needs of their communities with rules that focus on the things that really matter, whether it's scientifically valid, whether it's, for example, contaminated by marketing, those kinds of things that we focus on to make sure, and that the learning outcome is what you value, no matter how you get there. So that opportunity of creating diversity in learning approaches then reflects the diversity in learning needs, but also the technological delivery of that learning, how it's delivered, whether it's something you're listening to in the shopping line at your local store, or while you're taking a run, or when you're with a patient. Different types of learning experiences are going to drive a different type of skill development program. And then you take from that the opportunity to embrace and engage a whole different diversity of faculty teachers. We might have a repertoire of standard teachers we might turn to say, that person always gives a great lecture on thyroid disease, we should have him or her back. That's not always the best way to achieve your outcomes. Maybe you should take a risk. Go to that person who isn't often asked, who might have an opportunity to deliver a new way of thinking about, let's say, something like thyroid disease to that audience. And then it's a matter of ensuring that The diversity of patient needs is reflected in the educational content. Our patients are as diverse as the rainbow and as the clouds in the sky. And the opportunity to say to individuals, listen, you may be used to thinking about a dietary recommendation for a patient with diabetes who is white and has a Midwest diet. But what about that Vietnamese immigrant who's maybe been here for 15 years, but that's not her diet, and you want to be sure that you're not making recommendations that are insensitive or, based on some view of what a person might eat. So that opportunity across the range of diversity of educational content, the types of educational approaches that individuals need, the faculty who might deliver it and how they represent and can think of new ideas, and then the diversity of patient needs that are out there based on their unique characteristics means that you have to elevate and create an opportunity for an extraordinarily complex, deep, and wide system that meets everyone's needs.
Yeah. One of the things I want to pick up on that you mentioned was the importance of taking risks. We have this great lecturer and it's working. So let's just go to that. And, hey, maybe we need to take a risk and try something new. And sometimes in an organization, the leader might sort of say that and feel comfortable with that. But then others inside the organization that are, in different roles, it might be harder for them. And sometimes it's tough to get the organization to be willing to have that growth mindset and go beyond what's normal and take risks. So I want to kind of ask you about influence on the inside. I know that, internal influence matters as much, if not more, than external reach. And I wanted to ask how you create alignment and trust on the inside to build the kind of culture that you want, and also to get people to be comfortable taking risks.
Yeah, it's a toughie because I think I am much more risk tolerant than, just like you said, many people around me, even on our internal team. And um, it is tricky when you're a regulator to take risks because sometimes it introduces a change, and change in the accreditation or the regulatory system sometimes is exhausting for everyone else around it. So you have to be thoughtful about setting reasonable timelines, communicating carefully about it, but then internally managing risk and change requires, first of all, agreement on the ultimate goal, because you don't just take a risk for fun, right? Not with big systems and structures. You take risks because you think it might generate outsized, benefit for the ecosystem, and that's why you might take a risk. And there's a whole sequence of risks we have taken over the years. I mean, one was, for example, just setting up an annual meeting of our accredited providers. Like, we just decided, like, we're going to do this thing. Let's see if it works. Other things are like, let's create a revision strategy for our standards. It's a risk. Like, you're doing what? These are things that you do. Or let's build a digital ecosystem for tracking all continuing education information for everybody. What? You're crazy. Why would you think of things like that? But if you didn't take these risks, we wouldn't have the functioning ecosystem that we have right now, because the status quo is very seductive. The status quo feels very comfortable and compelling, and there's lots of reasons to stay in that corner, and not do much new. Internally, I think it's about having the trust of your team to say, let's give it a try. Let's try this new communication strategy. Let's go on a podcast with Anthony. let's try things that are different to see if we can have a positive impact on our world, and then be willing to say that didn't work and just stop, move on. You have to call it when it doesn't work out, and we have several examples of that too. So I think it's primarily setting the goal, creating an ecosystem that doesn't punish people for following you along and taking that risk, recognizing that not all risks work out, and then being willing to pull the plug when it doesn't. So you move on and focus on other things.
Yeah. You're so effective at putting things into frameworks like that and steps too. I just have to say, it's really a great way to organize ideas. You mentioned your like digital ecosystem for um, uh, certification data, and I want to ask about technology. How has technology changed the way you think about influence? Could be on the inside, could be on the outside, and how do you approach staying relevant and effective in new formats and with new platforms?
There's so much there. We could spend an hour talking just about technology and not just how we manage accreditation, how we manage our communication as a team, but of course how we think about education writ large and how people are learning, for example, and using educational technology and AI to define what they need to learn, to answer
For sure.
questions for them, and then to remind them and consolidate learning and help them improve over time. All of those things are true. There is the downside risk of technology, which is that the consumption of technology and certainly learning with educational technology is absolutely terrific for individual learning and for focusing on what does Anthony or what does Graham need to know today to build his or her skill in a particular way. That's a very individual journey. But learning and performance in healthcare is a team-based program, and you worry that if Anthony is learning a whole sequence of skills and building his capacity, but they're very different from the journey Graham is on, and we don't get together, then we're not going to perform together. So technology has real benefits in terms of what it can do for individualized growth, but it has a potentially deleterious effect on how we get together to socialize, use the social learning environment to share information, to build off of each other, to teach each other, to show respect for each other, to learn how to work together. So there has to be a balance between how we learn as an individual and how we learn as a group or a team to try and build our skills. But there are just tons of ways in which leaders need to be leveraging technology. We brought, for example, ChatGPT's voice system into our VP's meeting the other day, and we're just like, let's have a chat with ChatGPT. Let's put it on the table and see what she comes up with. She has a female voice on my phone, and it was so curious and so interesting. It felt so natural to have a conversation, and I was like, "Hey, ChatGPT, I'm bringing the VPs for our organization into the room. Let's have a conversation together about things we should work on." And let's bounce some ideas off each other. And she would listen quietly for a variety of the conversations. And then you would say, what do you think, ChatGPT? Should we do X or Y? You're like, these technology tools are pretty extraordinary in terms of what it can sometimes bring to help you brainstorm, think of ideas you haven't thought of, build or customize a lesson plan, identify learning needs, deliver an educational innovation, to come up with an assessment strategy for learning or evaluating a new skill. We have to be right in the mix of technology, and we have to be at the forefront because we have to decide what we're going to accept and encourage and nurture, at the same time recognizing that it's not a panacea. It comes with its own risks and disadvantages too.
Well, and what a great example of what you said earlier about that risk tolerance and demonstrating that, building that reputation of trust. You bringing that into a meeting, that could have gone awry, right? But you brought it in, and that was a risk that you took that showed other team members the potential of taking a risk. So I think that's an example that really illustrates what you shared earlier as part of your philosophy.
Yeah, I I I try to embrace technology, even as I worry about all of the things we all worry about, like security and privacy and reliability, all of those things we worry about. But if we're not playing with these tools and experimenting with them, we just won't know how to work with them. So we have to be doing that work. And I don't worry that they're going to put us out of our work, or that they'll delegitimize clinical medicine or education, because all of these things are innately human. And COVID taught us that we still really want to see our doctor or a healthcare professional because of the importance of trust and understanding the individual context of a decision that you might make, and relying on somebody to help you guide through that process and experience.
Trust and influence are just so hand in hand, aren't they? And I mean, I guess we could say trust is the currency of influence. And I wonder if you could talk a little bit more about that, because as we've, so much has evolved even since we started this show, when it comes to AI. And so I'd just love to hear your further thoughts on that.
Well, you can imagine a patient listening to me and me saying to them, listen, hey, you should take this chemotherapy for your cancer, and it's going to make you feel this way. It's going to be terrible. You're going to have these side effects, but trust me, it'll be worth it. I
Hmm.
just think of what that person is doing as they're making a decision to embark on a journey with a prescription of a dangerous and toxic drug that I might recommend to them, and how much they are relying on me to be the right answer for them. That I'm not going to put them in danger. I'm going to put their needs first, not my commercial advantage of doing more chemo or setting more lab tests or doing more X-rays or something. That they're just saying, listen, I trust Graham through this conversation to do what's right for me. That is the exact same dynamic that occurs when you're thinking about trying to make a big change in the national context or system. You have to say, listen, this is going to be tough. There's going to be change is always hard. A disruption is necessary, but it'll be worth it. And work with me. I have authenticity. I have trust. I have reasons. I have background. And I feel like this will be worth it. And this is why. And if you can back up those sequence of of statements with that history of having tried to build that trust, whether it's through your credentials or through your reputation or your affiliations, or just the legitimacy that you bring to a clinical encounter or an interpersonal meeting, those kinds of things make a huge difference to the ways in which you are received and perceived by the other person. And that allows you that openness then to actually have a conversation that gets people to join you on a journey where you want them to go and where you are working towards something together, whether it's a patient or a colleague to make a medication change or a systems change. It's really the same thing. But if you misstep, I mean, trust is so hard to gain and so easy to lose. It's painfully easy to lose that credibility and that trust. A small error, an poorly timed email, an acrimonious conversation that just was on a bad day, those things really interrupt our trust environment and our trust, calibration. And you have to be so careful about those. You keep your nose clean, you work with authenticity, you walk the talk, like you said at the start of the conversation, you build that trust, and then you can leverage that trust when you really need it. But if you don't have that background, you don't have that legitimacy, you're stymied from the get-go.
That is so true. And someone once told me, trust is kind of like a balloon. It takes a while to blow it up, and this one little pinprick, and it's all gone.
Yep,
And
absolutely right.
you gave some really good examples of building it, but also, diminishing it. Um, Graham, I'm a big LinkedIn person, so I had to take a look at your LinkedIn profile. I always love seeing how leaders show up. And I noticed a former colleague of yours wrote, this is a quote, "We need more Grahams in medicine." And this was after you gave them an opportunity to change the course of their career. So I just wondered if you could share a little bit about how you approach identifying and mentoring early career leaders, because obviously you made an impact.
Well, it is the joy of seeing somebody else benefit from what you can bring to the table that brought me to medical education at the very start. You heard me talk about, seeing that medical student's eyes twinkle as she got a concept that I was trying to, get her to grasp. That joy and saying I can make a difference for someone else is exactly why I decided education was going to be such a core part of how I show up in this profession and in this house of medicine. And I think the same is naturally true about how I try to support other people who are coming along, especially those who are struggling or having a hard time or on a journey like I was, whether that's as a young gay person, as an immigrant doctor, as someone who's trying to battle against a challenging system that they're unfamiliar with, or for whatever reason. I find great personal benefit from seeing something that I can do help them. But the same is also true about my continuing need for mentorship, guidance, and support from my colleagues. And I think leaders should not assume that they know all the answers and that they are just leading with mentorship and leading by example, all of which are incredibly important. But they're also allowing themselves to get wisdom and advice from people that they trust, even outside of their field, or maybe even especially outside of their field. And I try and do that too, so that I pass forward, the things I've learned from my mentors, and I share my continuing mentored relationships and the trust that I apply to those people who I really appreciate their wisdom in helping me make the best plans and path forward every day.
I love that. Well, before we wrap up, I just want to ask you one last question. I know that outside of medicine, you've said that endurance running has really shaped how you lead. So I wondered if, to close, you could just maybe share a lesson that you've learned from that.
There's so many lessons. I'm pretty late to endurance running. I've been running since really I came to Chicago, which is a great running city, by the way. Um, and I found that it's taught me a lot of things. First of all, it teaches you patience. It teaches you the beauty of the human body, what it can do for you when you give it the opportunity to respond. It can teach you how to endure. It's called endurance running after all, but how to navigate the suffering for an ultimate goal that you're trying to work towards, and the importance of staying consistent and patient and working through that. But I also say it's taught me about the importance of, the team, and the social dynamic of running with others, learning from each other's, and using that space to be your best self. But also the importance of, just quiet time for yourself, whether that's, for me, it might be a long run. For other people, that might be, meditation or something. Just that opportunity to create a space that's just for you, to settle your thoughts and try and quiet the very busy mind otherwise. All of those things are lessons I've learned from running, but it is all about staying committed even when it hurts, and especially when it hurts. And I think that's true about chasing long-term goals, is that you set them, you commit to them, you stay consistent, and in most cases you'll be rewarded.
That's great. Well, I'm just so thrilled that we had a chance to speak with you today, Graham. We talked about a lot of different things, but I think we could call this episode "The Joy of Influence," because you brought that term joy in the word several times, but also just the feeling of it, as we talked about building a reputation of trust and maintaining that reputation of trust as just being a foundation, whether you're working with a patient in a very fast changing environment where how they get information and how they analyze that has shifted so much. Your own industry that you're into now around accreditation of medical, education, and the collaboration that you're doing, and some of the lessons around working together and collaboration, having that common goal, identifying steps to get there. I just think that there were a ton of incredible lessons here, but throughout all of those techniques and tactics, you really centered it around authenticity, the whole person, your whole person and your identity, as well as the other people that you're connecting with around those collaborations. And again, that sense of joy throughout. So thank you so much. We're just thrilled that we got to feature you as a chief influencer, and we really appreciate you sharing so many wonderful lessons with us today.
Well, thanks so much for having me, Anthony. It's been a pleasure chatting with you, and thank you for the work you do to elevate the opportunity to make a difference in the world in all sorts of different ways, because boy, we need that opportunity for all these people to shine more now than even ever before. So thank you for the work you do, and for driving innovation, facilitating evolution, and promoting best learning to help us be at our best for those around us.
Chief Influencer is a production of Social Driver. We help clients transform complexity into clarity with people-centered strategies. Whether you're looking to elevate the influence of your brand or of your leaders, check out socialdriver.com to learn more. For show notes or to nominate a guest, visit us at chiefinfluencer.org or follow Chief Influencer on LinkedIn.